Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. Today we're announcing 2 new cases of COVID-19. One case is in the central zone linked to close contact, and the others in the northern zone linked to travel outside of Atlantic Canada. We now have 30 active cases and 1 is in hospital. I want to take a moment before I turn it over to Dr. Strang, who will give you more details on our cases, to say thank you to all of you for the sacrifices you've made over Christmas holidays. By keeping your gatherings to a minimum, I know it hasn't been easy, but for the most part, many Nova Scotians found a way to celebrate Christmas safely. Our case numbers are low, and we want to keep it that way, but we can only do that with your hard work. So for that, Dr. Strang and I are grateful. Dr. Strang.
Thank you, Premier. I hope you had a good Christmas, too. And good afternoon, everybody. So since our last briefing on December 21st, we have identified 33 more cases of COVID-19. And as the Premier said, we have 30 active cases. Unfortunately, one of those cases is now hospitalized, but not in the ICU. I'm just going to run through some of the numbers because we haven't been here for a bit and we missed a day or two with no press release. So on December 22nd, we had 7 new cases, 3 in Central Zone and 4 in Northern Zone. On the 23rd, we had 4 new cases, 2 in Central Zone, 1 in Western Zone, and 1 in Eastern Zone. On December 24th, we had 7 new cases, 6 in Central Zone and 1 in Western Zone. And one of the cases that we reported on the 24th in Central Zone was an assisted living facility employee, and that was announced publicly by Shannex. Everyone on the floor in that facility has been isolated, and both staff and residents were tested. There have been no further positive results to date. People continue to be isolated, and they will be receive their second round of testing in the next few days. On December 25th and 26th, we reported a total of 9 cases, 6 in Central Zone, 2 in Northern Zone, and 1 in Eastern Zone. On the 27th, we had 3 cases in Central Zone, and on the 28th, we reported 1 case in Central Zone. And today, the December 29th, we now have 2 new cases, 1 in Central Zone and 1 in Western Zone. So in total of all these cases, 18 were close contacts of previously reported cases, 10 were travel related, so those are good news because those are in some ways cases where we can explain where their exposure occurred. But we have 5 of our cases that are still under investigation, looking for a possible source. We did have 1 case that was reported in Central Zone who had somebody who lives in another province or territory but is a Nova Scotia resident. And because of the protocol we have nationally around data consistency, that individual is included in as a Nova Scotia case, but there were no exposures, no implications here in Nova Scotia. The Nova Scotia Health Authority and IWK continue to operate testing centres throughout the holidays. Public Health continues to investigate and manage cases, and our labs continue to analyze samples. So I want to send a huge thank you to all the staff who are doing this work at a time when many of them would normally be taking vacation and spending time with their family. They are sacrificing their family time to continue to make sure that our COVID response is available for Nova Scotians. In the last few weeks, we have talked a lot about testing for people who don't have symptoms, and this is still available, so we're asking people to do the online self-assessment and book an appointment for their test or drop into a walk-in or a pop-up testing site. However, in a couple of our recent cases, people kept going to work and were going out in their community even while they had symptoms. So I have to take time today to stress how important it is for people who feel unwell, even if they just think they have a mild cold-like symptoms, that they need to stay home or go home right away. Even if you think it's just a cold, it's important that you do this. Far better to be safe than sorry. Even if your symptoms are mild, please go home or stay home, isolate from other people, and do the online self-assessment. And I also want to remind employers and ask them for their support for their employees so they can stay home if they feel sick, or if they have been at a location where there's been an exposure notice and they need testing and they need to stay isolated at home until they get their test result. Please support them to do that. It's far better for your entire workplace if that individual employee stays home while waiting for a test result, rather than potentially passing the virus to other employees or customers in your workplace. A key part of our ability to keep COVID well controlled during this second wave is having both easy access to testing for those who have symptoms, as well as asymptomatic testing. And the asymptomatic testing is especially important for those who are at increased risk due to their social activities or work. However, this only works if people know when they should get tested and get that done. Getting tested is a key way for Nova Scotians to contribute to our COVID response and help keep each other safe. So please, if you are feeling unwell or even minor cold-like symptoms, stay home, do the self-assessment, and then take direction from that. Do not continue to go out and about, go to work, etc. You're putting other people potentially at risk by possibly spreading the COVID virus. I want to talk a little bit about the variant strains of COVID, which people have seen have been in the news. As people are aware, there are now several cases involving new variants of the virus that have been reported in other provinces in this country. We do not have evidence of this yet in Nova Scotia, but we are watching carefully for it. Public health staff continue to take a very careful travel history for all cases, and we flag any case where there's international travel for the lab so they can request the appropriate genetic typing to be done. The federal government has extended the ban on travelers from the United Kingdom, and I, myself and people in my office continue to participate in discussions with colleagues across the country about ensuring international travelers complete their strict 14-day quarantine period. And all of this, to me, shows how important the quarantine period is and that it cannot be replaced by testing. Nova Scotia's self-isolation requirements have been a key part of our success in preventing the case numbers other provinces and countries are experiencing. This holiday season, we put more rules in place and we asked all of you to celebrate differently. It'll take another week or so for our case numbers to tell for sure, but by all accounts, it sounds like Nova Scotians have stepped up once again. I want to thank all of you very much for your cooperation and your caring for each other. You have taken the importance of these restrictions to heart. I know that it hasn't been easy, but making these sacrifices is the best gift you could give this year, and I thank everyone for that. Our enforcement staff are also reporting that businesses are by and large doing their part to prevent crowds during this busy shopping season. The enforcement people have been out in full force and their reports are encouraging. So I hope the case numbers stay low and they continue to reflect all of your hard work. The next week, or the week that we're in now of the holiday season, is critical for us. Traditionally, this is a time where people continue to travel to celebrate with family, and there are large family get-togethers and parties. Given what we know about how COVID spreads, it's important that we all continue to do what you have been doing to limit your travel, follow the public health measures, keep your socializing to a minimum, and when you do get together, keep your numbers small. No more than 10, and keep the people you gather with consistently. I've heard a couple of stories where families were planning to have rotating groups of 10, which would add up to way more than 10 people being in any given household. So consistency with the same group of 10 is as important as the overall number. So it's 10 and it's a consistent 10. Don't think that you can somehow get around the number 10 by having multiple groups of 10 spread throughout an evening. So just as people have been vigilant with Hanukkah, Christmas, Kwanzaa, or other celebrations, we need you all to be equally vigilant with your New Year celebrations this year as well. So again, keep your gathering small with no more than 10 people. Stick with your family or your regular close social group of 10. maybe have a Zoom party to say goodbye to 2020. I think we'll all be happy to see 2020 in the rearview mirror, and say hello to the hope of 2021. And if you're out there taking advantage of Boxing Week sales, remember that you'll have to line up with physical distancing, 2 meters between each other or between groups before you can enter most stores. But I would also encourage people to think about, instead of standing out in cold, look at other ways to shop online, or maybe go back at a time when there's not as many people and there's and there's less chance of you having to wait outside. And we now have information on our coronavirus website, so if you're not sure which restrictions apply to the community where you live, because we do have some slight differences still between what's allowed in Halifax versus other parts of the province. People, you can go to our coronavirus website, enter your address, and it'll pop right there for your specific community what the COVID restrictions are in place in that community. So I encourage people who have questions to go and use that online tool now. Moving on to vaccines. It's important that we remember that as we do all these public health measures, we will continue to keep our case numbers low as we enter 2021. And in my mind, that we need to do that, to put ourselves in the best possible position as we start to roll out vaccine across the province in a robust way. We did receive our first shipment of 1,950 doses of Pfizer vaccine on December 15th, and we started vaccinating the next day. We received another 3,900 doses on December 22nd. Clinics have been ongoing in Central Zone with a pause over the last few days. We've started up clinics again, and already 2,290 Nova Scotians have been vaccinated. As we've said before, we're starting with healthcare workers who are directly involved in COVID-19 care, as well as staff in long-term care facilities, and that's consistent with national guidelines. Last week, the federal government approved the Moderna vaccine for use in Canada, and we are expecting our first shipment of that vaccine this week. Our weekly shipments of vaccine are confirmed through January, and we now have the freezers and equipment needed for any type of vaccine at 5 locations across the province. So early in January, we'll be able to start vaccinating at these other locations, and we'll be able to start sharing with you in more detail about our immunization plans around the numbers of people getting immunized beginning next week. So this is our last planned briefing before 2021, and I'd like to finish by just reflecting on what we've accomplished together over the last 10 months. We held our first COVID briefing on March the 6th. That seems a long time ago now, Premier. At that time, we were only just starting to learn about this novel virus, and none of us knew what the journey ahead would look like. And over the months that have followed, the Premier and I have given a total of 87 briefings, including today's. We've done our best to be frank and open with Nova Scotians, providing you with up-to-date information to keep yourselves and others safe. We've also issued 776 news releases with case numbers and COVID-19 announcements. And kudos to my communication colleagues, Christmas Day was the first day in 10 months that we did not issue a daily case release. Along with communications is the epidemiologists who work every day to be able to provide the numbers to go in those releases. So thanks to all those teams. We've shared with Nova Scotians the news of 1,480 cases. We've mourned with you about 65 deaths, and we found hope with you for the 1,385 resolved cases. We've done nearly 233,000 tests in total since March, and the first testing center opened on March the 10th. And since then, and I think this is a tribute to many people's innovation and hard work, and we're on the cutting edge of this in the country, I believe. We've expanded our capacity with centers all around the province, the assessment centers. We also have the pop-up testing sites, and now we have the public health mobile units that we're using as well. Our lab has gone from initially 200 tests per day up to 2,500 tests a day at normal capacity, and we've been able to have a surge capacity, and we had a record high of just over 4,000 tests on November 30th. And again, tremendous work done by our laboratory colleagues. And on top of that, we've had almost 12,000 rapid tests that have been done through the pop-up sites. We've had a state of emergency that was declared on March 20th, and that has been extended 20 times, making it the longest state of emergency Nova Scotia has ever had. The public health order under the Health Protection Act was established March the 23rd, and as the pandemic has evolved, we've revised that 40 times to implement restrictions, to ease them, and apply new ones as needed. And ultimately, and most importantly, Nova Scotians have responded in incredible ways. You've washed your hands, kept your distance, and worn masks. You've adapted to working from home, or you've gone to work to keep important services going. You've worked long hours in healthcare and other essential fields critical to managing the pandemic. You've supported local restaurants and other businesses that have pivoted to serve their customers in different ways. You've checked on your neighbors and helped people self-isolate by buying them groceries. Even while staying apart, you came together to mourn the Portapique tragedy, and you've shown the world that we are Nova Scotia strong. And that wasn't the only tragedy we faced together. With every blow that was dealt us, you've shown our Nova Scotian resilience. And through this whole ordeal, you've consistently shown your sense of caring, community, and common sense. You have shown that kindness can spread more quickly than any virus, time and time again. I know that the COVID response has created significant financial, health, family, and social challenges for many of you. And while we cannot take all these challenges away, please know that they are recognized and steps continue to be taken to reduce the impacts. Having the right level of COVID control while reducing all these challenges is my ongoing top priority. I came here in 1999, and while some of you so thank you all. Not over, and we still have a long road ahead of us, but we have vaccines approved, and it's now going into arms. And with the arrival of the vaccine, there also arrives a new hope that we will soon see a light at the end of the tunnel. But until then, let's stay the course, be COVID safe, not just for yourself, but for each other. Premier.
Thank you, Dr. Strang. And before I turn it over to Chrissy, I'd also like to say thank you to my elected colleagues who have been working over the last 10 months along with public health. And I want to acknowledge my chief of staff and those who work in the Premier's office who have been in here day in and day out for the last 10 months to ensure that we continue to communicate directly to Nova Scotians about all of the information that we have when we have it. But like a true politician, I'm going to ask for more. This is not a time, this is a time of hopefulness. It's not a time to give up. It's not a time to relax any of the efforts that you've been making as individual Nova Scotians or those of us who have the privilege to sit in these seats of elected office or here representing you in public health. We need to continue to be vigilant over the next number of months. I'm so proud of what we've been able to accomplish together, and I know we've got this as long as we stay committed to one another and to the path of following the public health protocols. Chrissy.
Thank you, Premier. Reminder, one question and one follow-up for the reporters that we have on the line today. First question will go to CTV's Natasha Pace.
Thank you. Dr. Strang, you talked about the variant and how it's popping up in other parts of the country. I know you mentioned public health is watching for it here, but hasn't seen any yet. Are you expecting to see that also pop up in Nova Scotia?
So, I mean, we don't have as much international travel. I'll put it this way. I wouldn't be surprised if we do see it. But the measures that we're putting in place now, working with the federal government and tightening and having a stronger quarantine requirements on people coming in, especially most people come in by plane. They come into 4 major cities in the country. So we're working with the federal government around making sure that they have appropriate quarantine on them. And all that, what it does is reduces the chance of anybody then traveling to Nova Scotia and being infected with the new variant strain. We have to remember, though, that no matter all the focus on variants, and there's probably going to be more variants out there, I heard it very well put this morning, that regardless of what the variants are, the virus remains basically the same, and what we need to do is continue to follow all the COVID protocols, regardless of what variant is out there. That's how we keep ourselves safe, staying focused on our personal measures, being prepared to accept and apply the necessary restrictions when we have to be tight. That's what we need to focus on. And while we pay attention to the variants, we can't let that distract us from what we need to focus on to minimize the spread of this virus, no matter what its genetic makeup is.
Go ahead with your follow-up, Natasha.
Thank you. Could you give a bit more detail about the person who's currently being hospitalized? Obviously, we can't identify them, but could you at least give us an idea which health zone they're in or an approximate age, anything of that nature?
I haven't been given that detail. I just get informed one of our cases is hospitalized, and we don't go any further than that for the privacy reasons.
Next question will go to CBC's Taryn Grant.
Dr. Strang, just keeping with the new variants for a moment, I wonder if it's possible that it's actually already in Nova Scotia, given what you said about not all tests, and correct me if I'm wrong, but not all samples are being tested for it, only those who are being flagged because they have been traveling.
So we're certainly moving forward. We are looking at anybody with appropriate travel history has been sent forward. We actually have a case. One of our most recent cases has recently traveled in South Africa. There is also a South African variant. So as soon as we became aware of that, we alerted the lab. The lab is forwarding that sample on for genotyping. So our system of recognizing travel and getting the right testing done works. Looking back, the labs across the country are now looking back to see what they know about different cases with international travel, and should we be submitting some of those samples retrospectively, looking for sampling. So that's part of the discussions we're having nationally as well, about doing not only proactively but retrospectively looking at necessarily samples from international travel. But I do know in all the cases we've had, as I've thought about them, we have had very small numbers of our cases have been from international travel, or sorry, I should say travel outside of North America.
Go ahead with your follow-up, Taryn.
And again, this one's for Dr. Strang. You talked about how it's important in the second wave to continue with asymptomatic testing, but I wonder what the future is for the rapid testing sites that we've seen. I know that there are still some in Halifax this week, but as I understand it, those are most effective during outbreak situations, and since our case numbers are getting lower and lower, I wonder if rapid testing will continue.
It's certainly part of our plan. Our thinking is continue to do our three kind of streams of testing. We have primary assessment centers. People can go there whether they're symptomatic or asymptomatic through the online booking process. We're certainly going to continue to use our mobile testing centers, the mobile vans for public health, when it makes the most sense to bring a van on site to test a group of people. We're in discussions about where we go next with our pop-up sites as well. They are clearly an important piece of our testing, focusing on communities where there may be university students as they're ending their quarantine period. That's one of the things we're talking about. So certainly the pop-up asymptomatic testing will be part of our ongoing testing strategy.
Next question will go to the Herald's Nabal Snan.
Good afternoon. Dr. Strang, I'm going to ask you again about the new variant. I was just wondering, do we have the capacity to do genome sequencing here in Nova Scotia, or are samples being sent to a central lab where all provinces are doing the testing?
No, that we would send those samples to the national lab in Winnipeg.
Go ahead with your follow-up, Nabal.
Thank you. And Dr. Strang, at the end of November at a briefing, you said public health was pausing backward tracing when investigating positive cases. So is that still the case now, or has there been a change in that?
No, we still do a combination, and in fact, some of the cases I was involved with talking with the MOHs over the weekend. Some cases it's very straightforward. If you have somebody who's traveled internationally or a rotational worker, you know who their contacts were. Our focus can be very much on forward-looking contact tracing. Other cases where it's more complex and we're not sure where the person may have been exposed, then we also do more what we call the backward-looking contact tracing, where we identify contacts and then we test those individuals as much to understand where the case that's in front of us may themselves have been exposed, and then who else may have been exposed, maybe a week or 2 weeks ago. So we use both approaches when it's appropriate for the type of case and the complexity of the case that's in front of us.
Next question will go to Keith Doucette with the Canadian Press.
Good afternoon. Premier, I realize that Quebec's health minister has called on the federal government to take stronger action to ensure returning international travelers respect quarantine rules when returning to the country. I wonder if you second that call, given the problem with the variant that's arisen.
Well, as you know, international travels come through 4 airports in our country. One is in Montreal, one in Toronto, I think it's Calgary and Vancouver. Those airports would be where I would argue that Quebec is calling for that extra testing and ensuring that quarantine has taken place. Here in Nova Scotia, we've had tremendous support from people coming home. I think one of the successes that has helped us, particularly over the last month, has really been those who've had quarantine orders on them have followed through on that. There's been daily checkups where if you follow the online form, there's a reverse situation where they need to call into us as opposed to calling into them to identify where they've been. And we've been able to pick up some viruses during that period of time, which has helped us to keep our case numbers low.
Go ahead with your follow-up, Keith.
And this is for Dr. Strang. Can you give us any details on Moderna vaccine? I know that we got, 3,700 doses in our initial shipment. Are there any at least preliminary plans for how that's going to be distributed?
Yeah, we're expecting that vaccine to come this week, and we've built our plans through January based on the understanding that we're going to get both Moderna and Pfizer vaccine. As I said in my remarks, folks are working this week to pull together more of those detailed plans. We'll be able to, starting next week, be able to talk in much more detail about what our immunization plans would look like in communities across the province.
Next question will go to Alicia Draus with Global.
Thanks. And just following up on the vaccine, I'm just wondering if you can give a little bit more update. I know you said that 2,200 Nova Scotians have been vaccinated. Is that all still those in the healthcare industry, or have we started with long-term care yet?
No, those are both people who have been in acute care providers who are on the front lines, potentially dealing with people who are infected with COVID, whether it's in the emergency department, our COVID units in hospitals, or the ICUs. But we've also started immunizing staff who are in our long-term care. We have long-term care COVID units, and we've started to immunize those staff in the Halifax area as well. As I said before, as we get the Moderna product, that has less stringent, temperature requirements. It still needs to be frozen, but just a regular freezer. So that product is easier to move around and start doing vaccination across the province.
Go ahead with your follow-up, Alicia.
Okay, and just in regards to the Moderna vaccine, how many are we expected to get this week?
Just let me look that.
3,700.
3,700. The Premier's got a better memory than I do.
Next question will go to All Nova Scotia's Rebecca Brown.
Hi. You mentioned, Dr. Strang, that over the holidays vaccinations were paused, and I'm just wondering for how long was the pause and why did this happen?
Pause was from the 24th to the 28th. It's really given we had very small amounts of vaccine. We'd only had 2 shipments of vaccine prior to the holidays. We wanted to make sure that we're in the process. We're holding back half of our vaccine, knowing that the first, we need people to get the 2 doses to be assured of their immune status. And now we're getting more vaccine with the Moderna this week. We'll be able to really, focus on a robust plan, rolling out the vaccine starting in January, which has always been what we've been working towards. We've been fortunate to have a couple of allotments of vaccine coming in early or later in December, which has allowed us to kind of test things out, both on the delivery and the administration of vaccine. But our plan has always been to really ramp up vaccine starting in January.
Go ahead with your follow-up, Rebecca.
And can you give an idea of how many people are getting vaccinated each day? And do you expect another vaccination pause over New Year's or anytime soon?
So we're rolling out clinics this week. I don't have the in front of me. New Year's Day is a Friday. I don't have the exact clinic and schedule in front of me. But we have limited amounts of vaccine in this week now. We're getting more Moderna this week, but by the time we get it, we don't have assurance of that and a set date yet. And so it's hard to finalize our vaccine plans until we get that absolute assurance. But certainly starting January 4th, when we know we now have going to get weekly allotments of vaccine, that we really have the robust plan moving forward starting in January for the first, again, as I've said before, the first 12 weeks are our first phase, which is focusing on those at highest risk, healthcare workers, long-term care staff, and residents.
Next question will go to Paul Waldenette with Radio Canada.
Thank you. Hi. The question will be for Dr. Strang. So you said that 33 new cases since December 21st, and I just want to know, are you satisfied at this point? Does it bode well for January? What can you say about that?
So out of those 33 cases, 28 of them are either close contacts or directly related to travel. But there's 5 that were still under investigation. We're not sure where they may have been exposed. It's those 5 that are the most concerning that we need to try to understand what is there a potential that they could be here, some local circulation of virus. 5 is not a big number, but my concern is if there is some low level of virus circulation and people haven't been following the COVID requirements for last week and this week, then we'll start to potentially see a spike the week of January 4th. And that's why we've kept our restrictions in place to a large extent, getting us through this holiday period. And we hope that the pattern that we're seeing, that our majority of cases are either known close contacts or travel related, is what holds into January, and that we don't start to see a surge or an increased proportion of our cases that would suggest they're locally acquired.
My apologies for the mispronouncing of your name, Wildenette. Go ahead with your follow-up.
Thank you so much. I just want to have maybe some clarification for the Moderna vaccine. Can you tell us which group will be in priority, who will be prioritized for the Moderna vaccine?
So our priority groups for the first 12 weeks, the phase 1 of 2021, remain, as I've said. There are healthcare workers who are directly involved in the response to COVID, so they're likely that they may well be treating somebody who's a COVID patient in our hospitals and emergency departments. They're long-term care residents and staff, and then when we're able to, we'll start to get into community living seniors, starting with those 80 plus. What Moderna does, different than Pfizer, the very tight temperature requirements of Pfizer, especially their requirements in the first couple of shipments, meant that we really were restricted to vaccinating here in the Halifax area. Moderna, as well as some of the loosening of the requirements around Pfizer, then are going to allow us to, still sticking with the same risk groups, but to start to immunize those risk groups across the province. It's one, and then so that's phase 1. Once we get into the spring, we hope to get a lot more vaccine, and that's when we can start getting into other broader groups.
Next question will go to Tim Biscay with the Halifax Examiner.
I have a question for the Premier. Dr. Strang just expressed, I guess, frustration that some people who were sick have been out in the community going to work. We've been told this since pandemic started that people shouldn't go to work if they're feeling ill. But there's no legislation in place to mandate paid sick leave beyond, to the amount necessary. Is that a failure on your government's part?
Well, there is a program set out by the national government. Our provincial legislation allows that to happen. So there are 10 paid sick days for anyone who has COVID.
Go ahead with your follow-up, Tim.
Dr. Strang, there have been all the new releases say it's either travel or close contacts with people or travel, and yet we're getting a long list of potential COVID advisories, and it doesn't. We've had in place the rule that that family members, households, are supposed to isolate as well. So how is it that there's these people out there going to retail places and such if they're supposed to be self-isolating?
So, first of all, the people who are travel are isolating. Often, when it's a close contact, they were at a. So when we identify somebody who's a close contact, they have to be under isolation from the day that we identified them as a contact. But they may have, and then we test them, and a number of those close contacts are testing positive. So once we then follow them up as a case, then we always look at where were they 48 hours before they became symptomatic, or if they don't have symptoms, 48 hours before they've been tested. And so very often they've been out and about during their so-called infectious period before they were identified as a contact and then identified as a case. So it's not that they've been doing anything wrong. It's just that once we do our follow-up, we identify that they have been certain community locations while they were considered infectious. And the third piece is, I said 5 of our 33 cases are people where we don't have a clear explanation. And so with them, we also do the same thing. They may have been out and about in the community when they were considered infectious. Again, not that they've done anything wrong, it's just that they were out before they became symptomatic in that 48-hour period, by and large. So that we have had a couple of cases of people still being out and about while they were symptomatic.
I think it's also important to recognize that these businesses who we're identifying go through a tremendous cleaning process. What we're trying to alert is the public who may have been at one of these businesses at the same time someone who's turned out to be positive. I just want to give a shout out to the entire business community in our province who continue to go through the proper cleaning protocols, whether it is a grocery store or any one of our other establishments. I want to reassure all Nova Scotians that the business community is doing all of its due diligence to ensure that they clean the facilities properly. And these alerts are really to let those members of our community who've been at these facilities at the same time just to know to monitor their symptoms.
Next question will go to Pat Healy with the Laker.
Hi, this question is for Dr. Strang. With the case numbers and our daily cases relatively low, is there a way to do a careful risk assess reopening for our small businesses like pubs, bars, and restaurants?
So thanks for the question, Pat. We're actively looking at that. And so, as we said in the briefings before we left for the Christmas break, that we're being very cautious, keeping things closed down as we get past New Year's. And then we will be looking at the week of January 4th. We'll be taking a very careful look at what our epidemiology is showing us. What we don't want to see, what we're hoping to not see, is a spike in cases, especially low cases that are likely locally acquired. And then based on that epidemiology, we'll start to look at, is it possible to start to loosen up some of the restrictions that have been in place? My hope is that we can, but I'm not going to get out ahead of myself before we have the epidemiology in front of us, and then have the conversation with the Premier about what can we do. I use the word balance a lot. It's always about balancing the necessary COVID restrictions, but knowing they all come with their own impacts. But our focus needs to be having the right level of COVID safety. So hopefully we're in a place early in the new year we can start to loosen things up a bit, but we have to get the right amount of time and get us the information on what the early new year looks like to see what, if any, impact the holiday weeks have given us.
Go ahead with your follow-up, Pat.
All right, this next question could be for both Premier McNeil and Dr. Strang. It's been a long 10 months with many more months ahead until we get to the end of the COVID tunnel. And you guys have put in a lot of hours, yourselves and staff, dealing with decision making and putting in place measures to keep us healthy and safe from COVID. So I'm sure many Nova Scotians would like to know, how are you both doing, yourselves and staff, dealing with all the pressure that's on you?
Well, thank you, Pat. I mean, I'm fortunate to be surrounded by a team that's very dedicated, very skilled. I have lots of colleagues across the healthcare system who are all very skilled at their work. So I think part of that is that we all, lifting the load together, if you will. I'm also continue to receive lots of cards, emails, gifts, whatever, from Nova Scotians, which give me great, strength and help me keep committed. And I've been fortunate to be able to be a bit more relaxed over the last few days, but I'm here for the long haul.
Pat, thank you for the thoughtful and kind question, and I appreciate the fact you pointed out and made the comment about people other than the two of us sitting here. We happen to be the face of each of our organizations, but staff who work for both of us have been through a tremendous amount, and I want to thank those Nova Scotians who often write me a note and acknowledge the contribution of staff who work in my office over the last 10 months. I'll be perfectly frank, it would have been an extremely impossible 10 months for me if I had not had the staff early on. Many of them isolated from their own families for a period of months before we actually knew what was happening, so that we could actually deliver a message to Nova Scotians. And now we're able to find different ways, but for me, I'm grateful, to be honest with you, that the support Nova Scotians have shown me and the kindness that they've shown me. And as hard as this may be at times, I've never lost sight. There are many, many Nova Scotia families that have paid a much bigger price than I have through COVID.
Thank you, and that's all the questions we have for today.
This is a season for gathering, and we're at the halfway mark. We've kept our numbers low during Christmas, but we're now entering the second half of this holiday season, and that is New Year's. A time when we normally stand in large crowds outside to do the countdown, or we mark the New Year's with a large host party. We can't do that this year. We must follow the protocols and keep our gatherings to a limit of 10. But what we can do, all of us, is take a moment to reflect on the chaos of 2020. This has been a year that has brought pain and sorrow to so many families. Those who've lost loved ones due to COVID, who've lost loved ones at Portapique, that senseless act of violence, and those who've lost loved ones in the tragic accidents that happened this year. Cyclone crash off the coast of Greece, the snowbird crash in British Columbia, and the Chief William Salas fishing vessel that went down in the Bay of Fundy. And let's not forget the personal and economic stress and hardship the pandemic has caused. This has been a year that has been marked by so many tragedies and suffering. Many days, it's hard to imagine how we, as a province, were going to get through this. Where were we going to find hope? But you pulled together. You didn't give up. You were kind. You shared love. You helped your neighbor. So when you sit down on New Year's Eve to look back at 2020, remember that through all of the hardship, you found strength. And as you look forward to 2021, take that strength and all that you've learned from 2020, the kindness, the love, and even gratitude, and carry it into the new year. It is my wish, as the vaccine is coming online, that you will have hope, and that your love and kindness will also prevail. Happy New Year, and please stay safe.